years since
Recording in
January
progress.
2021, as more older adults have been vaccinated and with changing social behaviors among the younger population. I want to just remind everyone also that our COVID hospitalization rates lag a few weeks behind increases in cases and would be expected to continue to rise for a few weeks after cases start to fall. Now, our current hospitalization levels are still only 1/4 of our fall winter peak and 1/2 of the spring peak. And we continue to report a low number of deaths, less than 1 per day on average since mid-July, which is down an average of 10 deaths per day just before we initiated our vaccination program in December. And we heard earlier this week from our colleagues at Washington State Hospital Association and the University of Washington that our regional hospitals are full, and they're concerned about getting overwhelmed in increasing numbers of younger COVID-19 patients in the ICUs and pleading with the public to take all possible actions not to get COVID-19. Now, I mentioned that most of our cases, hospitalizations, and deaths continue to be among unvaccinated people. For the 30-day period from June the 22nd through the 21st of July, 88% of COVID-related hospitalizations have not been fully vaccinated. 87% of COVID-related deaths are not fully vaccinated, and 75% of all cases are not fully vaccinated. During this time, compared to fully vaccinated residents, those who are not fully vaccinated were 5 times more likely to test positive for COVID-19, 11 times more likely to be hospitalized for COVID-19, and 11 times more likely to die due to COVID-19 related illness. And finally, among the almost 1.5 million fully vaccinated King County residents, less than 0.1% have had a positive test result for COVID-19 following vaccination. Less than 1/100% have been hospitalized for COVID-19, and about 1/1000% have died due to COVID-19. COVID-19 vaccines are continuing to provide high-level protection against hospitalization and death, but you need to get vaccinated for them to work. Now, about the Delta variant. 86% of sequenced cases in the most recent 14 days from King County are Delta variants, up from 78% last week. The combination of the more contagious Delta virus, large numbers of unvaccinated people, and abandoning COVID-19 prevention measures are the key reasons we're seeing an increase in cases and hospitalizations. However, relatively high-level vaccination coverage in King County, especially among our older adults, with 88% of adults over 50 years of age fully vaccinated, is providing a strong defense against what too many people in states across the US, and especially in southern states, are experiencing, with explosive outbreaks, overloaded emergency rooms and intensive care units, and stressed healthcare systems. Some states in the southern US with lower vaccination coverage have hospitalization rates that are 5 to 10 times higher than what we are currently seeing, and death rates 10 to 30 times higher. Thanks largely to COVID-19 vaccines, the hospitalization rate in King County, although rising and concerning, is currently the 4th lowest rate when compared to all US states. And we have the 2nd lowest current death rate compared to other states. But we do have enough unvaccinated people to sustain a Delta surge that will cause serious preventable infections, hospitalizations, and deaths. So it's important to know that if you're exposed to COVID-19 in King County right now, you're likely exposed to the Delta variant. And this virus is significantly nastier than previous COVID-19 viruses, and it's challenging us in new ways that we were not wanting to deal with this summer. Infected people have higher amounts of virus in their bodies. They're more contagious and more contagious for a longer time. And recent reports conclude that Delta is also more likely to lead to hospitalizations and ICU admissions than previous variants, although that still is under study. In infected people, the Delta virus grows to levels 1,000 times higher than previous COVID-19 viruses. and all that virus is exhaled into the air where other people can breathe it in. With Delta, people are contagious more quickly after exposure and for longer periods. Delta spreads easily through the air before you even know you're infected, beginning 1 to 2 days before the first symptoms. And this is why vaccines and other layers of protection are needed at this time, especially for unvaccinated people and those at high risk for serious infections. The bottom line, vaccines offer excellent protection against hospitalization and death from Delta, but if you aren't vaccinated, you're more likely to be infected, hospitalized, or die from COVID-19. I want to just speak a little bit about masks. Given the increase in cases and hospitalizations we've seen this week, I want to remind everyone of our recent directive that recommends everyone, regardless of vaccine status, wear masks indoors in public spaces. This is an easy step we can all take to add an important extra layer of protection. It helps protect people who aren't vaccinated, like children under 12, as well as people who have compromised immune systems. Universal masking in indoor public spaces provides a more reliable way to ensure everyone is staying safer in settings where it's not possible to verify an individual's vaccination status. And this recommendation is intended for indoor public spaces where the vaccination status is unknown, like restaurants, grocery stores, gyms, retail, and entertainment venues. And it's important for businesses and workplaces and other public locations to adhere to this guidance. I also want to take a few minutes to remind people about other COVID-19 risk and prevention measures, because COVID-19 is so widespread and increasing locally and throughout the US right now. And I know many of us will be traveling this summer. The most important message is that vaccine is the most effective, but not the only way to reduce risk. And in particular, it does not help the unvaccinated. So in addition to whether you're vaccinated, which is the most important single factor in reducing your risk for getting COVID-19 depends on a number of other things, including the nature and duration of your exposure to infected people, your underlying health status, your behaviors, and the characteristics of the virus itself. And this is true for both vaccinated and unvaccinated people, because no vaccines can give 100% protection. So exposure risk means something that increases with crowding and proximity or closeness to infected people, with longer duration of contact, with being indoors as opposed to outdoors, with poor indoor ventilation, and not using a face mask or using a low quality or poorly fitting face mask. Underlying health conditions also affect risk, especially severe immunocompromise, but certain other conditions and older age also. Behaviors that can increase risk include loud talking, shouting, singing, aerobic exercise in close or prolonged contact. And COVID-19 variants that are more contagious or cause more severe illness or evade protection from vaccines can also increase our risk. And here is something that's very important. Risk is additive. The risks you take add up. The more often someone does things that increase their risk, the more likely they will be to be infected. To lower your risk of COVID-19, do fewer risky things. Taking more risks increases the chances of getting COVID-19, including severe COVID-19, primarily for the unvaccinated, but also to a much lower, but not 0 degree, for the vaccinated too. Recently, locally and across the country, COVID-19 prevention measures were lifted, and vaccinated and unvaccinated people are doing lots of things together, often in close contact, indoors, and without taking adequate, or sometimes without taking any precautions. The Delta variant has compounded the all-around risk of our situation for everyone. So what does this mean? Vaccines remain the best way to reduce your risk for COVID-19, including severe COVID-19, but are not 100% protection. No vaccine is. Multiple layers, multiple strategies for protection can reduce the risk for both unvaccinated and vaccinated people where COVID-19 rates are rising or high. In addition to getting vaccinated, this is a good time to remember the other strategies to reduce the risk of COVID-19, including wearing a well-made, well-fitting respirator or face mask, ensuring adequate indoor ventilation and air quality, physical distancing and avoiding crowding, and minimizing high-risk exposures, settings, and behaviors. These COVID-19 prevention strategies are most important for unvaccinated people. But even vaccinated people, especially in a high-risk group for severe COVID-19 or who are a close contact of a high-risk person, should also take steps to further reduce their risk based on the local COVID-19 rates where you live or travel, your personal situation, and how much risk you are comfortable with. I want to say again a few words about breakthrough cases, which continue to be in the news. I want to reassure people that the main point here is that breakthrough cases do not mean vaccine failure. As more people are vaccinated, we hear about more COVID infections among vaccinated people, and that is normal and that is expected because no vaccines are 100% protective. We should expect to hear about more non-severe breakthrough cases as more people are vaccinated. COVID-19 vaccines are primarily intended for and valuable because they prevent serious infections, hospitalizations, and death. COVID-19 vaccines make it much less likely, but not impossible, that a person will catch and transmit COVID-19. Unfortunately, the Delta variant seems to increase the risk of vaccinated people developing less severe infections compared to earlier strains. And some of these cases can spread the infection to others. But COVID-19 vaccines continue to provide excellent protection from what is most important: serious infections, hospitalizations, and deaths. I'll provide you a quick update on our vaccination status for residents in King County. We have now achieved 70% coverage with one dose or more for all residents, and 65% of all residents have completed their vaccine series. If we look at just the 12 and older group, 81% have started their vaccination series, and 76%, over 3/4, have completed it. Over the last 7-day period, 10,400 King County residents received their first vaccination. Congratulations on making a good choice to protect yourself, your family, your friends, your loved ones, and your community. This is a 14% increase from our low point on July 20th, when 9,100 King County residents received their first vaccination. And this is great news because it represents a reversal in the recent trend of fewer people seeking vaccinations. And I hope this reversal is sustained. We've also topped 70% of people 16 years of older fully vaccinated in each major geographic region of the county, including Seattle with 78%, North region with 82%, South County with 70%, and Eastern King County at 86%. But we still have disparities among racial and ethnic groups that we need to close. Now, I want to let you know that we'll be posting some information later on our Public Health Insider website about recent outbreaks. People are doing more activities while taking fewer precautions, and several recent outbreaks have occurred in indoor workplaces and social events where both unvaccinated and vaccinated people are together, where ventilation was poor, and where people were not wearing masks. And these outbreaks that we'll be just posting information about this afternoon include an outbreak at a fitness center, an indoor music club, and a childcare center. And they illustrate important risk factors in common community settings and steps people can take to reduce their risk. And those are the steps that I've discussed with you just a few minutes ago. Now, with respect to COVID testing, I want to remind everyone that COVID testing is a vital strategy for limiting the spread of virus in our community, and that COVID testing guidance has recently been updated. So right now, anyone with signs or symptoms of COVID-19 should get tested as early as possible, whether you're vaccinated or not. And this means even mild symptoms. If you've been around someone who has a suspected or confirmed case of COVID-19, you should get tested 3 to 5 days after your exposure, even if you don't have symptoms. And if you test negative, it continue to monitor your health for 14 days following the exposure. And if you develop symptoms, isolate yourself away from others and get retested. And if you test positive for COVID, as always, even if you have no symptoms or mild symptoms, and even if you're fully vaccinated, isolate yourself away from others for 10 days. At this point, I am welcoming your questions and look forward to a discussion.
Thank you so much, Dr. Duchin. And for those who are attending from media, please use the raise your hand function and we'll answer your questions, and please include your media outlet. So let's get started. Kate Walters, you can go ahead and ask your question.
Hi, Dr. Duchin, Kate Walters with KUOW Public Radio. Thank you, as always, for these briefings. I'm wondering if you could indulge me in providing some sort of anecdote about a personal internal thought process that you've gone through, a conversation you've had in risk assessment, whether that's, whether or not to go out to eat, to see friends or family. I think a lot of folks are sort of struggling with how to make those decisions in situations where it's not 100% cut and dried. So could you walk us through how you've done that?
Well, thank you, Kate. You're absolutely right. It's not 100% cut and dry. It depends a lot on your individual health status, your risk tolerance, and what you're going to be doing, the level of risk that you might be exposed to. So, for example, I have not participated in indoor dining yet, and I'm going to at this point. I will dine outdoors where there's a well-ventilated and open space very happily and feel very safe in that environment. I, for many months, was unable to visit my 93-year-old mom who lives on the East Coast. And earlier this spring, I made the decision to fly. I felt that flying is a relatively high risk, or flying and travel is a relatively high risk activity because it brings you in contact with so many people, particularly getting to and from the airport, that people can take shuttle buses, public transportation, crowding may happen at the airport. And as I observed, many people at the airport did not wear their masks or did not wear them properly. They forgot that actually air can come in and out of their nose, so they only covered their mouth. Or some of them actually thought they breathed through their chins and only covered their chins. So I wore a very well-fitting N95 respirator that I got online from a company that is very reputable called Project N95. They're relatively inexpensive and comfortable. And I thought I wore that respirator for the entire duration of my flight. And when I was in close contact with others, and when I was shopping and in other public locations during my travels. I'm planning a first vacation in about a year and a half in a couple of weeks. And I'll be doing cycling mostly, which is not going to bring me in close contact with people during that activity, but there will be other times when I'll be around folks. I'll be carrying a similarly effective face mask for those situations where I'll be in close contact with people whose vaccination status I do not know. And I'll be wearing a surgical mask that I got from a company called Armbrust American that is very high quality, ASTM certified. I tie off the ear bands to make it snugger against my face. It has a nice nose bar, and that provides a decent level of protection for low risk activities such as, grocery shopping and so on. Now, I have my own personal health history to consider when I make these decisions, as everyone does. And I think about who is in my family and who I might expose, even if because I'm a vaccinated person, am highly protected, but I may get a mild or asymptomatic COVID infection because our COVID rates in this country are so high right now. And would I be, comfortable passing that along, and what steps might I have to take to prevent that from happening would be something someone should consider as well. I hope that covered some of what you're interested in. I'd be happy to talk more with you, offline if there are additional questions.
Thank you very much, and congratulations on the vacation.
Thank you.
Great, thank you so much. Michael Crow, you can go ahead and ask your question.
Hey, Dr. Duchin, two quick things. Thanks as always for doing this. I've been following your tweets this week about San Francisco General offering a booster for folks with the Johnson & Johnson, and I've seen you mention that would fall, outside, I believe it was the provider agreement and all, et cetera. I mean, are we at the point where you would recommend that for King County hospitals? And then I also just wanted to ask you, as you talk about the surge of Delta and the relaxed things, if you, again, I think I ask you this every week, but whether you're thinking of any restrictions to halt the surge because there are immunocompromised people and the unvaccinated, et cetera. Thanks.
Okay, sure. So first to the booster. So yeah, this issue that San Francisco General has raised is an interesting one. And I know that our colleagues at FDA and CDC are looking hard at what's happening. Now, clearly, everyone should understand that there is no recommendation for booster doses at this time for any vaccine for any type of person. Now, there's a decent amount of evidence and professional opinions in the medical world that certain people should be getting boosters, particularly those who have severe immunocompromise and perhaps some older adults. And some people are also thinking about recipients of the J&J vaccine, although there's very little data to know with certainty whether that's necessary or not. So there is a process that has to happen, for that to be sort of within the legal within the constraints of the emergency use authorization. FDA really would need to indicate that it's a permissible use of the vaccine, and providers who are participating in the federal program, which is where they get their vaccines, really are obligated to adhere to the current guidelines of the FDA and the ACIP. I'm not sure exactly how San Francisco General is sort of understanding their ability to give an unauthorized booster, but they are doing that. We are not encouraging it because the data really have not been evaluated, and there is no recommendation that a booster is needed for any particular population at this point. Clearly, I would like to see those data evaluated and a recommendation forthcoming as soon as possible if one is going to happen. But currently, there is no recommendation for a booster, and providers are really obligated to use the vaccine in the way that FDA and the ACIP recommend it. But it's a tricky situation because other countries have authorized boosters for older adults and for certain other groups, and that creates a lot of confusion and desire for people who live outside of those countries to do something similar. So I'm really hoping that the FDA can move quickly to provide clarity to what's happening at San Francisco General and guidance for other healthcare providers who may, in their professional opinions, think that's the best thing to do for their patients.
Great, thanks so much.
Sorry, last part of his
yes.
Are we considering any other further restrictions or mandatory actions at this point? Not at the moment. And again, we're seeing a lot of COVID right now, and it's causing many, many illnesses. It's causing an increase in hospitalizations, but it's not overwhelming our healthcare facilities. The deaths are stable, and we're a relatively highly vaccinated community. So I'm optimistic that if we continue to vaccinate and people adhere to some of the advice I gave today, in addition to the face mask, but taking some of these other preventive steps to just reduce the risk of COVID spread now, we'll be able to get through this surge without an intolerable number of hospitalizations and deaths. But if we see things getting out of control, we will absolutely have to consider taking further actions, more restrictive actions to decrease the risk of COVID transmission throughout the county and really throughout the state. I mean, the state is experiencing a very similar, if not worse, COVID surge than we are here in King County.
Thanks very much.
Thank you. And I'll just add, since we have a relevant question from the community, are you hearing discussions for schools and policy changes about schools? And is it impacting what you're seeing right now in the community as far as spread? Is it impacting the way you're thinking about what should be happening in schools moving into the fall as far as guidance?
No, the guidance for schools has just came out from the Washington State Department of Health, and I really hope that, first of all, we understand how important it is for children to get back to school and the harms that have been done by kids missing school during the past year. And I think everyone's priority should be on getting kids back to school safely. And there are a number of measures that can be taken to reduce the risk for children in the schools. And if those measures are taken, I'm optimistic that kids can return to school for in-person learning. But it's really important that people actually follow the guidelines around improving ventilation, the distancing as possible, mask wearing, and please, vaccination of everybody in the school environment who's eligible for vaccination. If we do all the things that we know are available to us, that are doable, the strategies that have been recommended, we will have kids going back to school in the fall. And, as with all aspects of this pandemic, there's no 100% certainty. There's no ability to predict the future. But based on, what we know, what other countries have experienced, and again, this is pre-Delta largely, the effectiveness of the measures that have been recommended for schools, it's very important to have kids return to in-person learning as safely as possible. And the guidance, I think, that it has come out addresses the relevant precautions that need to be taken.
Excellent. Thanks so much. Mo Hader, you can go ahead with your question.
There you go. Hey, good morning, Dr. Duchin. Can you guys hear me? All right. You kind of touched base on this with talked about the increase in Delta cases and hospitalizations. Not sure if there's an answer to this, but what's it going to take, in your opinion, for more people to get vaccinated, and especially for those who are still hesitant at this time about getting vaccinated?
Yeah, thanks. Well, there are many reasons why people may not have been vaccinated. There's not a one size sort of fits all solution here or answer. We know that vaccine mandates will motivate people, and you're seeing more and more healthcare and private businesses mandating vaccination to return to work, and that results in a very high level of uptake among their employees. There's also the issue of people really not understanding, the risks and benefits of vaccination, and truly being either misinformed or uninformed, or just not knowing and needing reassurance. And so we are working very hard, in the communities that have people who are hesitant, seeking information, on the fence, to provide them with information that they can use to make good health decisions. And of course, people are not stupid. People are smart. They know that when folks around them are getting sick and hospitalized, and young people are ending up in the intensive care unit with breathing tubes, that's not a good thing. And people will see that and want to protect themselves, I'm convinced. And we're seeing this across the country, particularly in those areas that have very low immunization rates, where they're being devastated with hospitalizations and critically ill people. And you've seen all these stories of young and middle-aged adults who are anti-vaccine and against the vaccine, who are in the intensive care units and pleading with their friends and families now to get vaccinated because they were wrong. And I think people will get the message. Unfortunately, the whole vaccination business and the masking business and the response to the pandemic in general has been a political issue in this country, where really it is a personal and community health issue. And I think we all share the common value of wanting to stay healthy. We all share the common value of wanting our friends, families, and loved ones to be healthy, and our communities to be healthy. And I think once we can let go of the political baggage and the other ideological, that's the right word, factors that are preventing us from looking at this as a public health issue, we will see more and more people realize that the vaccinations are excellent. They provide life-saving benefits, and will get vaccinated.
Right there.
Thank you. Olivia Palmer, you can go ahead.
Can you hear me all right? Okay, great. Yeah, I'm Olivia Palmer with Westside Seattle, and I have a question about businesses reopening, specifically restaurants and bars. I know people have been starting to let their guards down, and it's a tricky balance to navigate, wanting to reopen, but also wanting to keep folks safe. And so my question is sort of twofold. For those who are fully vaccinated or in spaces where, either all or a majority of people are vaccinated, I'm wondering, what the risk of transmission is there and how that works. And then secondly, just looking toward the future, at what point will it be appropriate to start letting our guards down more? And how do we get to that point, whether it's through increased precautions or herd immunity or something else?
Thank you for those questions, Olivia. Check out our Public Health Insider blog later this afternoon. There will be one or two outbreak scenarios that speak directly to your question. But the point is that we have a lot of COVID circulating, that this Delta variant is a new virus. It's a whole new ballgame. It's much more contagious, spreads more readily. It's airborne. People just need to understand this is an airborne virus. It floats around in the air, and it floats around in very high quantity compared to the previous viruses. So when you're in an environment with a lot of people and there's not a lot of ventilation, even if most of those people or all of them are vaccinated, there is some risk, but the risk is lower for people who are vaccinated, and the more people who are vaccinated in that space would be a lower risk. But you need to sort of understand individually, how much risk are you willing to assume? How important is it for you to go into a crowded bar where you don't know everyone's vaccination status, where you'll be in close proximity, where there may be poor ventilation, and make your own risk assessment at that point. Now, people can choose where to go. They can choose what bars to visit. They can choose what restaurants to visit, what businesses to visit, and they can make those decisions based on how safe those places seem. And they will go where I think people will go where they feel more safe. And that's why you're seeing many businesses now require vaccination for their patrons and their employees. So they want to provide a safe environment for their workers and their customers. And businesses will be taking other steps to improve the safety of their environment, such as improving the air quality and ventilation, and providing, if necessary, provisions for increasing distancing among people who may not be wearing masks, and so on. So, you can choose where to go based on, the safety of the environment. But I think everyone needs to understand now, anytime you gather indoors with people whose vaccination status is unknown, there will be a risk for COVID transmission. So making those indoor environments as safe as possible through, improving the ventilation, making a bigger space, decreasing the close crowding, masking if the vaccination status of everyone is unknown, will further decrease the risk.
Great, thanks so much. And let me give you another question from the community. Somebody's asking for some recommendation about whether employers should require testing, COVID-19 testing for employees who go on vacation and come back. What's your thoughts on that?
Well, I think it's a good idea for people who go on vacation to come back to test themselves. I'm just assuming that when you go on vacation, you're going to be exposed to other people who are unvaccinated, and you'll have lots of interactions and lots of opportunities to acquire COVID. So, there's very little to lose by testing yourself, and you may find that you have an infection before you become ill, and that will prevent you from spreading it to others. I think businesses have the right to do that. I think businesses have the right to also require their employees to be vaccinated. And if someone has a medical reason why they can't be vaccinated, testing, for example, frequently is a reasonable option to accommodate that person in the workplace if that's necessary, if they can't work from home, for example, to protect the other workers. For your question about whether businesses should require testing, it really depends on the specifics of that business, the risk, what the worker does, the type of contact they have, whether they're vaccinated, and so on. But I will just say that testing is a reasonable and important strategy to supplement vaccination where not everyone can be vaccinated. Or where people are not eligible for vaccination, for example.
Great, that's helpful. Thank you so much. Let's take a question from David O'Bells, and I may have pronounced your last name wrong, so please let us know. And David, you can go ahead with your question.
There we go. Apologies, I was muted. You actually got my name perfectly. Dr. Duchin, thank you so much for your service. Hospitalized COVID patients remain relatively low, as you noted, but there's very little capacity in acute care and ICU beds countywide due to a significant surge of just general care that's going on. If hospitalizations spike, are there contingency plans being considered and ready to implement? Are there any plans to stop elective surgical procedures at this time, or have any hospitals announced they're stopping?
Thank you.
Thank you again.
Thank you. That's a very important question. I have tried to continually engage with our wonderful Northwest Healthcare Response Network and our regional hospitals around COVID preparedness, and they have been incredibly responsive and proactive. We have an excellent hospital community. They certainly have good policies, procedures, and contingency plans in place based on the initial COVID-19 surge, and they all know how and when to trigger reductions in services to free up beds and staff and space. We're not there yet, but as you said, the hospitals are very busy, not just with an increasing number of COVID patients, but with many other types of illnesses, some of which are because people deferred care during the COVID outbreak, and others are unrelated to COVID, just unrelated increases in hospitalizations for other things. One of the major challenges that hospitals are facing and that we're trying to help them address is the inability to discharge patients who are no longer needing hospital care, but can't find a bed in the community, either in a long-term care facility or other sort of supportive care environment. And this is a very important problem for our entire healthcare system statewide that I'm hoping we can solve as quickly as possible, which will free up a significant amount of hospital space. So we're really wanting all hands on deck, so to speak, to try and understand how to address that problem. But to specifically answer your question, yes, our hospitals do have contingency plans in place for freeing up beds, staff, and space. Canceling elective surgeries is part of that, but is not something that happens early on. That's something that happens later after other strategies are used. And there is no plan to do that at the current time.
Thank you. And question from Nicole Jennings. Go ahead.
Good morning. I'm wondering, what would your advice be for anyone who wants to do some summer traveling fully vaccinated? Can they just go about things like a normal year, or do they still need to dial things back a bit?
You dropped out a little bit, but I think you said it's a person who is fully vaccinated who wants to do some traveling. Is that right?
Yes, that's correct. I'm wondering, can people treat this like a normal year in general, or do they still need to dial things back a bit and maybe stay closer to home, even if they are vaccinated?
Okay, so this is not a normal year. This is not close to a normal year, and everybody needs to understand that, vaccinated or not. As I mentioned earlier, there's a lot of COVID everywhere right now, and people can be exposed to COVID anytime they're around others whose vaccination status is unknown. It's very uncommon for a vaccinated person to get COVID from other vaccinated people. I mean, that would be extremely, extremely rare, and I wouldn't worry about that. But I would be worried about the potential to be exposed to COVID, even if I'm vaccinated, if I'm around a large number of people who are unvaccinated or people whose vaccination status I don't know, who aren't wearing masks. And if I would be, for some reason, in close contact with them, or in a crowded area with them, or in an area where there's poor ventilation and not good air quality indoors, for example. So I think people who travel do need to be aware that there's some risk, even if they're vaccinated, and to take steps to minimize the risk, the low risk to themselves. But everybody can decide whether or not they want to accept the risk or not, or what precautions they're willing to take or not. But they should understand that there is some low risk, even if you're vaccinated. And you're very unlikely to get a serious infection if you're vaccinated. You're very unlikely to get hospitalized. You're well protected against the serious outcomes, but you can still develop COVID-19. And I'm sure you've heard about the large outbreak at Provincetown. There have been a number of outbreaks around the country. There have been outbreaks locally where vaccinated people have become infected. So it's not impossible, but it's unlikely. But again, this boils down to your own risk tolerance. How much risk are you willing to take, and how important is it for you to do that activity that places you at risk? And the other thing to think about is, would you potentially spread COVID to someone else, even if you didn't get a severe case, who may be susceptible to a severe infection. So I don't think people should, and I'm going to speak about this in a minute in the closing, but I don't think people should by any means forget about COVID right now. I think we have to have it front and center because of the Delta virus. And if you're traveling, you have to understand what the risks are related to the type of travel you're doing, your destination, types of activities you're going to be doing, your underlying health status, and the people that are around you, and then make the best decisions you can for your personal health. But you should be reassured that if you're vaccinated, you personally are very low risk for serious COVID-19 infection.
Thanks so much. And I think I will ask you a few questions just to dive in a little bit more of the issue of breakthroughs, because we're getting lots of questions about that based on the statistics you shared. So I think what would be helpful is if you could break down for us and for the community the difference between some of the statistics you talked about when you're talking about among COVID cases, the numbers that you're seeing around vaccinated versus unvaccinated. And then you also shared statistics about the number of cases when you look among all those that are fully vaccinated. And if you could help characterize for folks how to be thinking about this right now. There's also some questions about the fact that wondering where we're getting the data on that, given there's some conversation that CDC isn't tracking breakthrough cases, may only be tracking hospitalizations and deaths. So if you could explain a little bit more about where we're getting our data around that, that'll be helpful.
Sure. We get the data from our own surveillance system. When people get tested in King County residents, the labs are required to report that test result to us. And when you're vaccinated in Washington State, your vaccination record goes into a Washington State immunization registry. So for every COVID case, we can check on their vaccination status. This has nothing to do with CDC. This is local data. So it's very complete in that sense. However, one thing that may be on the readers or the viewers' minds is that, there are mild cases that we may never hear about if people don't get tested. And that's true of COVID in general. We know that only 1 in 2 to 1 in 5, depending on where you are, cases actually gets diagnosed and tested. So we know that not every case is represented in our figures, but the cases that are sick enough to get tested are. Now, the various different types of statistics I presented are just different ways at looking at the breakthrough, issue. Now, again, breakthrough infections, so-called, are to be expected because no vaccines are 100% effective. So for example, just take the scenario where we were able to vaccinate everybody. Knowing that the vaccine isn't 100% protective, the only cases that will appear will be in vaccinated people because everybody's vaccinated. That doesn't mean the vaccine's failing. Right? And it's likely that those cases would not be serious cases. So the higher the number of people that are vaccinated in the community, the more breakthrough infections you would see. That's normal and expected. So, when we talk about things like the proportion of hospitalized cases that are vaccinated versus unvaccinated, and the proportion of deaths that are vaccinated versus unvaccinated, those are sort of general ballpark figures that give you some idea of how much of an impact the vaccine is making in protecting people, but it doesn't give you other important information that we're hoping to provide in a more detailed report, perhaps next week, such as, well, are those people who are developing COVID-19 who are vaccinated, are they at much higher risk than other people who are developing COVID-19 who are not? So for example, you might expect that when I say that 87% or 88% of COVID-related hospitalizations are not fully vaccinated. So 12% of them were vaccinated. Are those 12% perhaps people who have underlying immunocompromise and didn't respond well to the vaccine? Or are they nursing home residents who are of advanced age with underlying health issues? Or are they young, healthy people, which would be very unlikely? We're going to be looking at that in much more detail to give you a better picture of exactly what is happening with respect to breakthrough cases. But in general, we can say that the vast majority of people are getting hospitalized right now have not been vaccinated. And that's sort of the bottom line for those proportions. Now, the other number, the other number I think that's really important are the risk, the relative risk. How much more likely are you to become hospitalized or die if you've been vaccinated versus unvaccinated? And that looks at the number of people among all those who have either been vaccinated or not vaccinated who have that health outcome. So right now, you're 11 times more likely to be hospitalized or die from COVID if you're unvaccinated. So that just gives you a level of the relative risk, but not the absolute number of people who are being hospitalized and die. And then finally, the larger statistic, again, is just a general number to give you some ballpark feeling for how many breakthrough cases have occurred among those. They're not even breakthrough cases, they're just cases have occurred among those who have been vaccinated. So among the 1.5 million people almost who've been fully vaccinated, only 0.01% have been hospitalized. Now, these aren't strictly speaking breakthrough cases, because in order to be a breakthrough case, you actually have to be exposed to COVID-19. So this is the thing, that's a little bit hard to understand about these numbers where you hear one less than 1% and so on. They're very accurate and they're correct numbers, but they're not actual, breakthrough numbers. Breakthrough numbers really have to be based on the number of people who are exposed to the virus, and among those who are exposed to the virus, what proportion develop illness. These larger numbers, these summary statistics, really are just another way of looking at the volume of people who've been vaccinated and the volume of people who then have developed COVID-19. So it is a bit of a complicated issue. I can see why it's hard for folks to understand, but the bottom line is no matter how you look at it, vaccinated people are at much, much lower risk for hospitalization and death, and lower risk, significantly lower risk for getting any type of COVID-19 compared to those who are unvaccinated.
Thank you so much for breaking that down for us, Dr. Duchin. This is why we need amazing epidemiologists and public health professionals to help us understand. So very much appreciate that. And we put both in Facebook and also here in the media chat some slides that help describe this. And if you do have questions, we know it's complicated, feel free to reach out and we will do our best to help provide you with accurate information. We know it's a particularly complex time in the outbreak. So thank you very much for that, Dr. Duchin. Let me turn it back over to you for any final comments.
All right, thanks, Sharon. Again, thanks for everyone taking the time to join us. I know this is just such a marathon. We've been at this for so long, and really this pandemic is continuing to challenge us in ways that we haven't even imagined, and we should continue to expect additional challenges and uncertainties with respect to other new variants, perhaps, and other aspects of our prevention measures, duration of protection, and so on. So much uncertainty will persist, and we should expect that. But over time, as more people are vaccinated, the overall pandemic threat will recede. People need to understand that there will be an end to the COVID-19 pandemic. It's not going to be immediately, unfortunately. We're going to have bumps in the road. There are going to be progress and setbacks, but this pandemic will eventually recede and be controlled. But for now, our outbreak continues to evolve, and our understanding is evolving, and our actions need to evolve as well to reflect the reality of our pandemic. Delta denial is dangerous. I know that no one wanted to be grappling with a more contagious COVID-19 variant this summer. I certainly did not. And we have multiple effective ways to reduce the risk for all, while we continue to be able to do the things we want and need to do more safely. And that's largely because of the high vaccination coverage we have here, relatively speaking. But at this time, vaccination alone is not enough, because not everyone can be vaccinated. We need to continue to use all the tools available to us. So I encourage everyone who is eligible to be vaccinated now to wear a well-made and well-fitting face mask or respirator when in indoor public spaces, and take other COVID-19 prevention steps as needed to reduce your risk during this Delta-driven surge. Over time, both this current surge and the overall pandemic will recede. And along with all of you, I am looking very much forward to that day. So thanks again for joining us, and I look forward to speaking with you again in a couple of weeks.
Thank you very much, and thanks for joining us.